Thank you, Mr. Fitzpatrick. You are now recognized.
Thank you, Mr. Chairman. Thank you all for being here today. A key challenge facing my constituents back home in Bucks and Montgomery County in Pennsylvania has been the increasing staff shortages in the healthcare industry, forcing many patients to be turned away for necessary care or alternatively to receive suboptimal care to meet their needs. This is coupled with increased pressure on the professionals administering this very care. As has been brought up in this hearing, staffing for these specialized post-acute care facilities is especially concerning in my home state. In Pennsylvania, PA is projected to have the most dire shortage of staff for skilled nursing facilities by 2026. And reportedly, nearly half of Pennsylvania Healthcare Association members plan to close or sell at least one of their SNFs this year. Dr. Madison, in your professional experiences in home health, can you speak to how staffing has changed in recent years, and moreover, how have these potential challenges impacted your ability to treat your patients?
I certainly can. Thank you for the question. In Lubbock, Texas, 6 years ago, we did a study, and at that one point, we're a city of 260,000. We were 1,000 RN short and 1,000 LVN short, and that's a backfill hole that that's a hole that you can never backfill enough. So we are dealing with it right now. Telehealth would help with that tremendously. If we could do telehealth visits, one particular nurse could make 20 visits a day instead of the normal 8 that they make. For those patients that don't need to actually have hands-on care that day, I think telehealth would be a great way to take care of those patients. We also lost a lot of nurses during COVID because they did not want to be subjected to some of the viruses and stuff that are out there. And then also you have disabled nurses that can no longer handle the hospital care work that's demanded of them. We could put them to work also.
And Mr. Dungilli, in your experiences and observation, are you able to speak to how staffing concerns have impacted your administration of care?
Yes, like Texas, and the state of Nebraska in 2025 is forecasted to have a shortage of RNs of over 5,000. And so you can't absorb that. And so I think what we find within my state is holding beds that could potentially be opened if we had adequate staff. It's widespread, not only in the post-acute sector, but in the acute hospital sector as well. So it does impact the provision of care and patients' access to it.
And moving on to long-term care hospitals, these hospitals play an essential role in caring for our seniors with serious conditions. Ms. Graber, several years ago, Congress created the criteria for LTCH eligibility, requiring a patient to have an ICU stay or 96 hours on a ventilator for an LTCH to receive a higher payment. What was the rationale of this change?
Thank you for the question. I believe part of the rationale behind it was that the Medicare Payment Advisory Commission had recommended to Congress to put patient criteria into place for long-term care hospitals. MedPAC recommended an 8-day ICU stay, and when Congress legislated it, they codified a 3 ICU day. So I believe that that was some of the background behind how Congress got to the 2013 policy.
Got it. Back to you, Mr. Dungilli. Are there patients who might benefit from an LTCH care who do not meet this criteria? How would this change impact their care?
Well, thank you for that follow-up question, because yes, we can understand the reason to create criteria, but we believe that 3-day in the ICU stay went too far. There are other patients who are critically and chronically ill who could benefit from the services that a long-term care hospital provides that haven't maybe been in the ICU. There are certain hospitals, for instance, one hospital in our market right now has 25 patients waiting in the emergency room, waiting for a patient bed. Some of those patients can get into a unit within the hospital that can deal with their critical chronic condition instead of the ICU, but because they're not in the ICU, because of the bed availability, they're not then eligible to come to the LTAC. So we think they should be expanded.
Thank you, Ms. Dungilli. I yield back, Mr. Chairman.